Now, the surface epithelial stromal tumors, otherwise called ovarian epithelial carcinoma, what are the tumors placed under that group? You have the serous tumor, endometrioid tumor, mucinous cystadenocarcinoma. Which tumors are called sex-cord stromal tumors, sertoli Leydig cell tumors, and erinoblastoma and granulosa cell tumors. Then which are called germ cell tumors basically? 6 tumors are called germ cell. One is germinoma, otherwise called dysgerminoma, embryonal carcinoma, endodermal sinus tumor, choriocarcinoma, teratoma, polyembryoma, and gonadoblastoma. So the examiner didn't ask a very big question. Did you go through the classification table or not? The minimum expectation before giving you the DGO seat. But not the Brenner's. Now what is Brenner's tumor? Let us talk about it. Brenner is that uncommon tumor that is a part of the epithelial stromal group of the ovarian neoplasms is what need to be basically remembered. TB affects the fallopian tube. That is the reason infertility is happening in this country, though it is a populous country. Now let us talk about the precocious puberty. What are the causes? You have, when do you call precocious, doctor? In the case of the boys, if it is before 9 years. And in the case of the girls, once upon a time 8 years was the criteria, but nowadays it has become 6 to 8 years. Then CNS abnormalities which can lead to precocious puberty include the tumors in the brain, intracranial tumors. And also you have got McCune-Albright syndrome, which can be a cause for precocious puberty both in male and also the girls and boys. And also certain tumors like the Leydig cell tumor, which can also lead to that. But not the testicular feminizing syndrome does not lead to any kind of precocious puberty. How does testicular feminization syndrome children will present themselves? 2 ways they can present. One is in the newborn period they can have inguinal masses. So it is thought as inguinal hernia, surgery was done and the testis is found in that. By testicular feminization syndrome, what is the karyotype? XY is the karyotype. Then in the case of the teenage, they can present with primary amenorrhea. So they don't present with precocious puberty. Is the testicular feminization is there in the options? Like sometimes options to frame them also is difficult. It will be made too open that you don't need to think about it. Then photopsia are classically a feature of, how many answered as Berlin's edema in the exam? So Germans don't get the mark. So choroiditis was there in the options? Very much. So choroiditis can lead to development of photopsia, retinal irritation, micropsia, macropsia can be there, blurring of the vision will be there. During our entrance paper discussion, suppose if how our attitude used to be like, suppose we answered Berlin's edema, we used to say, maybe your choroiditis is right, my Berlin's edema is also right. Because we will be in that state of what you call rejection and denial. Why Berlin's edema was answered? Can anybody can say? Because Berlin's edema is commotio retinae, retinae is retinal epithelial irritation, and that is the reason probably photopsia occur, because photopsia occur whenever there is a retinal epithelial irritation, and that is the cause in choroiditis in fact. But unfortunately, though there is retinal irritation, still we don't get photopsia in Berlin's edema. So that is how the warrior Karna is dead in the battle, though he was a very good warrior. So there can be some atypical reasons. So sometimes when we reason in an entrance hall, we may end up in Berlin's edema. No regrets about it. At least you had that analyzing mind, be happy about it. The treatment of the male counterpart is not really required in which important situation? Basically, bacterial vaginosis is not a sexually transmitted infection. What is bacterial vaginosis, doctor? Gardnerella is the one which is responsible. So there is an imbalance in the natural bacterial flora which become exuberantly growing, leading to the development of the bacterial vaginosis. So there is a reason we don't generally treat the male sex partner of the woman with the bacterial vaginosis is considered to be the management. Then contributory negligence. What do you mean by contributory? Examiner gave some errors in the Sunday test paper and student also did some errors. Finally, student was only doing errors. Some part your patient contributed, some part you contributed, finally he died. Contributory negligence. But only patient contributed, but you are sincere in writing that, is it called contributory negligence? No. Contributory negligence, if proven, definitely is a defense against the civil negligence, but not against the criminal negligence is what need to be remembered. Now let us go to the next question. A copy, a square, triangle and diamond. Let us talk about it. By 4 years we can copy a square, a triangle from 4.6 to 5.6 and a vertical diamond at the age of 6. So he is unable to copy the diamond means he is not 6 but less than 6. He is able to copy the square, and triangle means he is definitely 5 years. 5 is there in the options? Okay. Aseptic autolysis is what you see in the case of the maceration is what need to be remembered. Who is a catamite? A very important question. Basically, sodomy is that anal intercourse between two males or a male and female. It is also called buggery. It is called gerontophilia when the passive agent is an adult, and the pedastry when the passive agent is young, and that young boy who is a passive agent is also called catamite is what need to be basically remembered. Now what is covered under ESI Act? When was it started, doctor? It was started in 1948. The small power using factories employing 10 to 19 persons, non-power using factories employing 20 or more persons, shops, hotels, restaurants, cinemas, road motor transport establishments, newspaper establishment, they all come under the provisions of the ESI Amendment Act. So what was the option then? Newspapers, small power who are using 18 and non-power using 20 and more. As house surgeons we also come under ESI. Hospital is a power or non-power using? Generally there will be no power in the hostels. So we come under non-power, definitely we are more than 20 house surgeons, right? So we should also have ESI. How much is the salary that should put you under coverage of ESI, doctor? 6,500 rupees is the salary. What is the present housemanship stipend? Less than that. ESI, so we are not eligible for it, okay. Now, which vitamin is not absorbed? It is the biotin which is being prevented by the avidin. So if you boil the egg, you will not have avidin. So boiled egg is superior to that of the raw egg in that sense. Now prognosis of the PEM is decided by what? First tell me, are the options are correct? Then we'll go for discussion. Because any option I can justify. Bleeding diathesis was there instead of what? Instead of hepatomegaly. Acha, theek hai. Basically the WHO manual gives what are the prognostic indicators of PEM. In that age less than 6 months is very much there, and dermatological lesions is there, hypoglycemia, hypothermia is also there, but unable to find keratomalacia in this group. So that way it should be a possibility. Do you have any other reference to say bleeding diathesis? Bleeding diathesis is a marker of hepatic dysfunction, one way. So if you get the reference, please let me know. Now this is a very interesting question. Extracellular fluid concentration of the potassium increases to 10. You call it as hyperkalemia. Now what happens in the hyperkalemia to the resting membrane potential, and why does ECG changes appear with the tall peaked T waves? Let us talk about this topic. Basically the potassium and sodium concentration is maintained by the sodium potassium ATPase, all of you know very well. And it is the one which will pump the sodium outwards, and it will pump the potassium inward across the cell membrane. Now whenever we have hyperkalemia, then what will happen? It will decrease the resting membrane potential. That means it becomes minus 90 volts. From that value it will go to minus 80 millivolts. That means it becomes less negative or more negative? Less negative it becomes. So what was the options given? It becomes more negative. So that is not a true statement. Let us look what happens else. And it continues to become less negative, and that lead to a decrease of the Vmax, and it will slow the conduction of the myocardium, and that will That is how you see on ECG, prolongation of P waves, PR interval and QRS complex, they are all the features that are seen. Now the other important thing is, as the potassium levels increase in the extracellular space, you have some potassium channels. The conductance of these potassium channels will typically increase. So what was the option given? Increase in the conductance of the potassium channel is very much a true statement. It won't affect the sodium conductance and it won't cause the inhibition of the sodium potassium ATPase. That is what typically happens in the case of hyperkalemia. Now let us talk about the mRNA, doctor. What is the structure of mRNA? How does it look like? It has got a 5 end, it has got a 3 end. On the 3 end it has got a poly A tail. On the 5 end it has got a cap. 1 2 comments about each of them. This 5 side cap, what does it contain? Guanine nucleotide, which is predominant there, and it is very important for the recognition and the attachment of the mRNA to the ribosome, and also it will protect the mRNA from being degraded by the 5-exon nuclease. Then you have 2 areas called 5-UTR and 3-UTR. What are they? They are the untranslated areas in the mRNA structure. They are responsible for the mRNA stability. Then you have the poly A tail, and poly A tail is the one which is there in the end. So what was the answer for this question then? Poly A must be the answer, right? Now let us go to the next question. What is the least quality protein? Gelatin is least quality. Lactalbumin is a complete and a high quality. Why gelatin is a least quality? Because of the absence of the tryptophan inside it. Then according to the protein quality, foods can be divided. Egg is considered to be the highest biological value containing protein that you ever come across. Now, what is an absorbable suture? Which is a non-absorbable suture that we use in the surgery? Basically, absorbable sutures are basically called cat gut. But is it the Mary's cat's gut? It is being taken? No. Name says cat gut, but it is the sheep's gut from where it is being prepared. Then polyglycolic acid, lactic acid, caprolactone, they are all the ones which are responsible, they are all called as absorbable. And you have got the natural fiber, silk, which is fundamentally non-absorbable. And the polyester and nylon and polypropylene are also examples of non-absorbable, so polyester becomes the answer. Rhabdomyosarcoma is the one which can spread to the lymphatic route, all of you know very well. Now how many answered magnesium for this? Deficient in TPN. Reasonable answer. But I also have got other references. But magnesium is trace element. Once more, trace element was there in the frame, right? Okay, let us check whether it is trace or not. But definitely there are 5 important elements which are deficient in TPN patient. Iron, zinc, copper, chromium and selenium. They are the ones which are basically deficient, and out of all it is the zinc deficiency which is commonly associated with the TPN. And when the patient, your post-operative patient is on TPN, doctor, how do you know that he is having zinc deficiency? He will have alopecia, stomatitis, perineal rash, facial rash. When it is developing, think of the zinc deficiency. Was the zinc was there in the options given, doctor? Very much.